All right. What do you do when a parent tells you, my baby is hungry? How do I know they're getting enough? Let's talk about how we can respond in those scenarios to make for the best breastfeeding outcomes and the most support for our families. So, the first thing, validate their feelings. Then, provide something they can do about it. So, you don't want to just say, I know it's so hard, and not give them anything useful to do. They want to be able to help. So, validate their feelings. It is hard. It can be normal. Let me show you what to look at. Here are things to watch to make sure that your baby is getting enough milk, or to see if they're not getting enough milk. So let's look into it. It's really comforting for parents to know we're not just willy-nilly about this. We actually are looking at certain things, which you know this, but they don't. So we're actually looking at certain things to make sure their baby's okay. So, and then they also have things that they can look at on their own to make sure that their baby's okay and that they'll be doing when they go home. So let's have them start practicing in the hospital. What are they going to look at? Number of feedings each day, number of wet diapers, number of dirty diapers. Let's talk about each of those a bit more in detail. A newborn baby should nurse at least 8 to 12 breastfeedings each day. Except day 1, the average baby shows feeding cues only 6 times. So it's okay if that baby nurses 8 or more times. That's great. But it's also okay if they don't get there. We're not going to freak out day 1 because we know the average baby only shows feeding cues 6 times. Remember, they're having that big period after birth where they're resting and recovering, and it would be very normal if they didn't eat during those hours, 2 to 6 or so. Wet diapers. They should have as many wet diapers as the baby is days old or more. So at least 1 wet diaper day 1, at least 2 wet diapers day 2, and so on until they get to day 6, and then it's at least 6 wet diapers every day after that. If they get sick when they're a few months older, that will be a different story, but at least 6 wet diapers each day after day 6. Dirty diapers. So day 1 and day 2, they should have at least 1 to 2 dirty diapers. And day 3 and each day after that, at least 3 dirty diapers each day. The color is going to change from that black, meconium, sticky, hard to get off their booty if it sits on there for any time, to brown or greenish brown or yellowish brown, to yellow and seedy by day 5. So you can educate them that if their stool is changing, that's a good sign. That means that they're taking milk in enough to change their stool. We have these bookmarks that I call them with guidelines for nursing mothers on the back. So all of our breastfeeding families should get these, and you can use this as a resource. You can say, remember that bookmark you have with the phone numbers on one side and the chart on the other side? That's this. They'll get it typically the first time a lactation consultant goes to see them. On the other side, it has our phone number. So if the number of nursing sessions or the diaper seems off, call someone who specializes in breastfeeding. So call us. Our number's that first highlighted one that goes right to our office. They can leave us a message so we can call them back. We are back to having latch and learn groups on Thursdays that they can just pop into. We have outpatient appointments they can schedule for. Or down below, there are other resources on here too. So if they need help on a Friday or a Saturday or some day where we don't have outpatient help, they can call, for example, Milkworks Omaha or other resources in the area to talk to someone who specializes in newborns and breastfeeding. Because all nurses don't know the same amount of information, right? And sometimes the person who's answering a call center call may not have a very extensive knowledge about breastfeeding or those first few days. So to her or him, a 3-day-old who hasn't peed in 8 hours can seem like an emergency, when in fact, a 3-day-old's goal is to have 3 wet diapers that day. So they very well can go 8 hours in between and be perfectly fine. So that's why it's so important to encourage our families when they're going home or when you're having this conversation with them about goals to, if something seems off with their number of feedings or their number of diapers each day, to call someone who specializes in breastfeeding. And then I tell them, we also watch your baby by weighing them each night. That's the fourth thing that we know about them that you won't know at home, but we'll know about it here, and you'll know about it at that follow-up pediatrician appointment. We expect them to lose weight for about the first 5 days and then to start gaining again so that they're back to their birth weight by about days 10 to 14. It's about the whole picture, not just one number. And that's something that's important for us to remember as nurses. That's something that is important for all of the practitioners treating babies. Don't forget to look at the baby. Same thing with the parents. Don't forget to look at your baby. Do they look healthy? Are they vigorous? Are they showing feeding cues because they want to go back to the breast? Or are they really sleepy and difficult to wake up? The American Academy of Pediatrics recommends follow-up on days 3 to 5 of life in the pediatrician's office or whoever's going to see this baby after they're discharged from the hospital. Weighing the baby at this time helps them see how minimally baby's losing or how drastically baby is losing weight. Remember, we expect them to be losing weight still. This is probably going to be about the lowest because by about day 5, we expect them to stop losing and start gaining weight again. So it's okay that they're still down from their birth weight, and it's okay that they're down from their hospital discharge weight. But we want to see how much down. What's the curve look like? Is it starting to get less deep and more shallow, or is it starting to get more intense of a decline? That's what we're looking at. We're looking at the curve of their weight loss. So when a baby's feeding frequency seems excessive, when the parents are like, okay, yeah, but still my baby wants to nurse 14 hours every day or constantly, or they never seem satisfied. There are a lot of reasons for this. And so we want to talk about the normal reasons for this while also making sure we're checking all of their symptoms to make sure this baby is on track and doing well. So one, the reason why baby wants to always be on mom's chest and get back to her is because mom is familiar. She has the same sounds, the same voice, the same heartbeat, stomach sounds. She's warm. She has food. They don't know anything about that crib or bassinet. They know mom. And so when they're in the crib and they wake up, they'll start to do feeding cues to get back to mom where they know they're comfortable and safe and they can thrive. So that's reason number one why they sometimes want to go back to mom when they're laid down. Number two, breast milk is low in protein. This helps the baby go back to the breast often so that they can help stimulate mom's milk supply. So those frequent feedings encourage her to create a stable milk production for the long run. The more prolactin receptors that mom builds in the first 2 weeks, which she's going to build those prolactin receptors every time baby goes to breast, the more prolactin receptors she builds in those first 2 weeks, the easier time she has keeping her supply up throughout her breastfeeding journey. The easier it will be to bring her supply back up when it goes down if, say, she gets sick herself, or she's away from baby, or she goes back to work and couldn't pump as much as she wanted. Anytime her supply dips, if she has more prolactin receptors, she's going to be able to bring it right back up a lot easier just with baby breastfeeding. So baby going to the breast frequently those first 2 weeks helps build a lot of prolactin receptors that helps her supply in the long run. So what can these parents do? Now you've educated them about why their baby wants to go to the breast so often, about what to look for. They can feed the baby frequently. They can hold baby skin to skin a lot. They can obtain deep latches because the further baby is latched onto the breast, the more milk they're going to transfer, the more receptors they're going to create in mom's breast because they transferred more milk, because she had better stimulation, and then her milk supply is going to increase faster, which then will make the baby be satisfied quicker. So obtaining deep latches. Hand expressing after feedings does two things. They can give whatever milk they get to baby through a spoon or finger feeding, and it also tells mom's body to make more milk. So it's a really great way to stimulate her milk production also. So they can hand express after feedings and give baby a little bit of dessert. All right, so to recap, when a parent says, my baby is starving, validate their feelings, educate them on what goals they can watch for, and also tell them what you're watching for, like their weight and a little more explanation about what you're doing, that you won't let them fail their baby, and educate them on how to be proactive with helping their baby feel satisfied and mom to make enough milk. All right, thank you for watching.